contribution. I'm deeply concerned. Today it was raised by my colleague here, Deputy Matthew McGrath, about the absence of pre-leg scrutiny, coming back to the issue. And a justification was made for that we didn't have the time. But did you consider, Minister, carrying out an impact analysis or any sort of assessment on the possible impact that the restrictions and indeed the draconian measures would have on people, on their lives, and indeed on people's access to other health services such as cancer screening? I've said all along with these measures that I am very concerned. I feel that the cure is worse than the disease in most cases. I am aware of cancer patients who were delayed in being transferred to hospitals. I am aware of issues with screening, where it also has impacted on the people and caused them extra distress. And I'm also aware, Minister, of issues regarding people who can't take the vaccine because they have a number of allergies to medication. Now, I have made personal representation to medical professionals about these issues. I'm aware of one constituent who cannot receive any sort of an answer and who is left in limbo. Can't receive anything from a medical professional to advise her as to what she does due to her allergies to many other medications. So I think something needs to be issued quickly to those people. I'm concerned, Minister, and the fact and the reality here is that we have 900,000 people on our hospital waiting lists. We've had an increase of 124,000 since August 2019. We can't just forget about those people because of the current crisis.
You can continue, but I'm just drawing your attention to it. We're past the second stage. I hate to interrupt you.
Yeah.
Valid points, but we're on amendment number 1.
I understand, Lascian Corla, but I may not get an opportunity, and I'm being very brief in what I'm saying, and I do believe that these are noteworthy points and the points that my constituents have asked me to raise here this morning, and I will be as quick and as brief as I possibly can. Minister, the point and the overarching point I'll make to you is that life can and should go on. We can't stop everything, we can't dial down tools, and we can't do this to people. There's heightened anxiety in children, and I know Deputy Naughton referred to the point there with the Children's Ombudsman asking for a review of the mask wearing every 2 weeks. I support that. There are deaf children who are in a great deal of distress because they're being forced to wear masks. Now that comes back again to my original point about an impact analysis. If you couldn't do the pre-leg scrutiny, why not an assessment or an impact analysis to consider the ramifications and indeed the legal ramifications of what's after being imposed on people? Because I do believe that this will give rise to many legal challenges. People are already distressed, children are suffering from very high levels of anxiety, and mental health services are in disarray. I'm aware in my own constituency that the mental health services in Borough County Offaly have not resumed since COVID-19 began. Now, unfortunately, mental health issues, along with other issues, don't go away because we have a pandemic. We need to be sensible. We need to make sure that we are aware and indeed dealing with all of the other medical issues that are out there. Why weren't the ICU beds increased? Why weren't our hospital staff numbers increased dramatically? It just seems unfair the way you've gone about this, and indeed unjustified. It's very rushed, and it would make more sense and indeed serve government better to take the time and consider the serious impact that you're having on people, because my fear is that more lives will be lost, not because of the pandemic, but because of your inaction. In terms of our hospital waiting lists and the inaction and the time that's been lost. I'm aware of babies being presented and indeed phone calls being made to GPs, and the babies, the parents are being told to get the COVID test first. Now, if that was meningitis, the time lost there could be very serious and lead to a loss of life. I'm concerned, and I believe these points need to be raised, and that's why I make no apologies for raising them, because I believe common sense needs to prevail and we need to be fair to people.